Hello everyone, my name is Anastasia Wallace, and in this video I'm going to be providing you all with a brief overview and critique of Sentara Healthcare System's Professional Practice Model, or PPM for short, as you'll hear me refer to it throughout this video. The reason I decided to go with the Sentara Healthcare System specifically is because I personally have had a lot of my clinical rotation experience throughout nursing school at Sentara healthcare facilities, and so I wanted to take a more in-depth review on the PPM that is used for all Sentara healthcare facilities. So Sentara is a nonprofit organization that is based in Norfolk, Virginia, where its headquarters are located, and it has over 300 different sites of care, 12 of which are hospitals that are located here in the Hampton Roads region. They have different centers such as outpatient centers, they have ambulatory centers, they have home health and hospice care, they have nursing and assisted living care, and ambulatory centers. They are national leaders in health care, stroke care, and kidney care, as well as infection prevention. And their vision is to ultimately be the healthcare of choice for their community. So the Sentara PPM is divided into 4 components or councils which work together as one unit to optimize patient care. The first of these councils is the Quality of Safety Council, and as the name suggests, this is the council that is responsible for optimizing patient care as well as safety, and also identifies any trends in patient care, meaning that whether they be positive or negative. For example, if they were to notice a more frequent central line associated bloodstream infections or more frequent catheter associated urinary tract infections, this council is going to be the one responsible for making all staff members aware of that, as well as trying to figure out what the facility as a whole can do to decrease the frequency of those infections. So that's just one example. The next council is the Education and Professional Development Council, and this council is the council that is going to be responsible for providing opportunities for growth and education for the staff members. So all of those continuing education programs that you hear about in any healthcare facilities at which you work, this is the council that is responsible for putting those out there for the staff. The next council is the Professional Practice Council, and this council is the council that is responsible for creating and revising the policy which we as the medical professionals use to base our practice. And this council also provides supplemental educational tools for the patients. So when you go to your units and you see those living with heart failure or living after a stroke and rehabilitation therapy, those pamphlets that you may see at the front desks at your units, this council is the council that's responsible for putting that out there for the patient. And the last council is the Research and Evidence-Based Practice Council, and again, as the name suggests, this council is the one responsible for putting out proper protocol on which we as the professionals use to base how we use evidence-based practice. And it makes it standard for all disciplines across the board. Overall, I think that this is a very good PPM for nursing practice. I feel as though nursing practice should always include patient safety and high quality of care, as well as collaborating with all the other disciplines and incorporating evidence-based practice. And all of these factors used together will increase or enhance our patients' overall health status. Because of the different councils that work together, it provides all of the healthcare staff to provide a very holistic plan of care, because again, it involves those different aspects that I mentioned before to work together cohesively to make our care plans more specialized and individualized to our patients. The only negative thing I will say about this PPM is that there's not necessarily a component that involves the family members of the patients, which I think is very, very important because, again, patient care is something that is supposed to be collaborative, not only the relationship between the healthcare members and the patients themselves, but also the families, for these are the ones who are ultimately going to be taking care of these patients when they are no longer in our care. But despite um, that one suggestion, I would say that this practice, a professional practice model, is um, one that's very broad, meaning that it encompasses a lot of different aspects of care, and I think that they all work very well together. And this is something that I've seen myself personally, having been at some of these Sentara healthcare facilities. I think it is a great healthcare system, and I am more than excited to see more new advancements that they may be making as a leader in healthcare in the Hampton Roads area. So overall, I find this PPM very, very good, and I hope that more healthcare systems will use it to develop their own and, of course, cater it to their facilities specifically. But I hope that this was insightful for you, and I hope it gave you a good idea on um, what Sentara Healthcare bases their beliefs and their values on. And I thank you all for watching.